Before we pass it off here to John and to Kathy, I want to let you guys know a couple of things. As I mentioned, we did open up this presentation to all of our YouTube subscribers, the 50,000 on our channel. So welcome if you're watching on YouTube. Please post your comments in the thread so that way we can answer them towards the end. And if you're a member of MS Workouts, super happy to have you here. And y'all know we talked about this beforehand. You get priority access to your questions. Okay, so feel free to unmute your mic during the presentation. You won't appear on screen, and we're going to answer all the questions, okay, for y'all first before we get to the YouTubers. Members of MS Workouts, if you want to add all of our live events, because we host live events every single day of the work week, if you want those in your Google Calendar, go to your Sunday newsletter that you should be receiving as a member, and then just click the link to import. So if you're not a member of MS Workouts, you're a YouTube subscriber, right? Perhaps you may not be aware, but MS Workouts, we offer a membership club, and that's who we're hosting this weekly Q&A for, but we did extend it for the YouTube channel today. But MS Workouts was created in 2017 at the CMSC convention after a research proposed by Dr. Lori Mayer, who is on our team and who you will hear more about later on. We use a unique training system called Steady Pace. What we really want to do is add muscle to the MS population, right? For all the benefits that provides, whether it's boosting mobility, protecting your bones, helping you manage your MS. That's what we offer, right? It's really muscle building, strength training, exercises, and much more. The cool thing is we have an app, so you can access all of our workouts on the MS Workouts app. And then we offer workouts, stretches, yoga, movement drills, and these weekly presentations. So a lot there for y'all to join. And the cool thing is that we host a live event every single day, whether that's a workout, whether that's a yoga, or excuse me, aerobics class, and there are no extra fees, right? It's all included in your membership. For 2025, we really want to help you guys commit to your health because it's super, super important. I mean, I'm sure if y'all have been to your doctors recently, they have told you, hey, exercise, strength training, right, is crucial. And it's a non-pharmaceutical alternative as well, right? So we really want to help you commit to your fitness in 2025. So we're offering you the ability to get the annual plan paid in monthly installments. So instead of buying the annual plan for $468, which includes the band, the app, you can get it now for $39 per month, okay? The offer does end on Thursday, January 16th. So please make sure that you stay up to date on that, okay? So at this point, y'all, we have our presentation from Cytokind, okay? So this is a special presentation by John McMahon and Kathy Reagan Young. The Cytokind, they offer a non-pharmaceutical treatment for MS using UVB light therapy. Kathy is an MS patient and advocate who uses UVB light therapy and then will share her experiences later on. And Dr. Lori Mayer, right, from MS Workouts, has actively contributed to the clinical trial design for UVB light therapy for MS. So I think it's really great that there's a connection there. So with all that being said, John, I'm going to go ahead and pin you one moment here. Okay. All right, John, the spotlight is yours.
Great. Well, Felipe and Alcir, thank you so much. Dr. Lori Mayer, who we actually met at CMSC also, and where this research we're going to talk about was first presented. It really ties not only the relationships, but mostly the attitude that we share that MS Workouts does, which is conservative therapies are needed for the MS patients so they can manage their symptoms and do as much of it at home as possible. And so we've really got to know you over the past few weeks, and we hope today's discussion really resonates with your community, because from what we've learned about you, we have a lot of synergy and how we respect patients and want to see them benefit. If I can go ahead and share the screen, if that's okay.
Absolutely, John. Go for it.
All right.
And I see it. Let's see here. It's loading. Perfect.
Okay. We're good?
Perfect, John.
Thank you. My name's John McMahon. I'm a co-founder of Cytokind. We're going to introduce you this therapy. I actually recognize some of the MS workout community who have actually reached out to us. So I look forward to So we already know there's some overlap in our community and yours. And we're going to talk about a translational therapy. And by translational, I mean this is approved in the field of dermatology, where it's been reducing inflammation and improving outcomes for decades, as good as any pharma in dermatology. And we see this as really needing to come forward to the MS patients. And it's safe. It's been used in children and during pregnancy, which is important during MS. And we're going to do this introduction and as well talk about the clinical trial results that are out there. This is an example of one series by Davlin, which Kathy has been using and we'll introduce you that she's been doing. We're mostly researchers. Recently, we've had enough interest in what we're doing that Davlin has partnered with us. They're the world's leading manufacturer of lights. So that's going to allow us at the end to talk to you about how you can get access to these therapies because they exist. A big part about what we're going to do, of course, we thank Dr. Mayer. Both MS Workouts and Cytokind are fortunate to have her guidance. This topic is a broad topic. Hopefully it's going to be informative. We're going to empower patients to understand a nuance that's very unique to MS patients and how you can not attack it, but how you can manage it. And then, of course, we'll talk about trying to get access to devices because we don't want to just talk about them. We want to find patients that get a fit and get them treated. So these lights have been around for a long time, and the dermatologists have really done the heavy lifting. They're primarily used for psoriasis, which is an underappreciated autoimmune disease. Psoriasis has excess inflammation, similar to MS, but the presentation results in lesions on the skin, where in MS, it's attacking your nervous system. But what it's been doing for decades that's been documented is it resets the inflammation, that runaway inflammation. And that's the opportunity that we really see here to bring forward. The best outcomes are consistent with MS Workouts philosophy, which I think is one of the reasons Lori brought us together, is because the best outcomes are now for these lights at home. So much more convenient. They get used more often. Patients do better. And that's really our commitment. We're looking to take this technology and these results from dermatology and bring it to autoimmunity. And MS, we'll talk about why MS is really the first disease that we want to tackle. Any questions so far? Everyone feel free to ask a question. I think we're going to touch on some interesting topics, but please don't hesitate if you would.
Thanks for checking in, John. So far, no questions in the queue, so you're good to go on this next topic.
Thank you, Felipe.
Yeah.
So we're going to use terms that we use interchangeably, which is sunlight, the sun, and UVB, but they're really not. So this is just a little informative slide. The sun emits the lights that we visibly see. That's our classic Roy G. Biv in the middle. And that doesn't really change from the summer to the winter. It also emits ultraviolet light. And those are not visible to our eye. And one of the reasons is because they oscillate. In the summer, we have a lot of it, and it goes away in the winter. I'm in New Hampshire. It's 25 degrees outside. We haven't had enough UVB to make a difference here for months. I know we have a colleague, patient here from Alaska. So, but the research, the reason that sunlight and MS have such a unique relationship is because it's really connected to the UVB, which goes up in the summer and goes down in the winter. So if you want to think about a UV index, that's sort of in your app or in your news forecast, you need a UV index of 3. And we look at that as a threshold to really stabilize your inflammation. It's also the threshold to make vitamin D. And In December, as you can see, only Texas and Florida has enough UV index to make it. So what's that led to is the research, it's been known since the 1950s, that wherever there's more sunlight, MS patients, there's fewer MS patients, and they have better outcomes. And I don't mean this is like a little difference. There's basically no MS near the equator, right? And you got to start moving away. When you move to the north of the US, excuse me, this is from an article in Neurology that looked at the US population. You see that New England, where I live, has the highest MS. So we know we have longer winters. That means we have less UVB. And we also have, places with lake effect snow. Syracuse and Buffalo have some of the worst levels of it. So there's this environmental aspect that's been known to impact MS patients. If you live in an area like I do, you'll get diagnosed earlier, you'll have more brain lesions, and you'll have faster progression. These are real complications. So if there's one takeaway here, it's for the patients that are on this call that have MS. One of the things that most commonly is a concern for them is their children. And there's an aspect here that we're going to talk about, that the biggest signature for your relationship with MS and sunlight is really fixed during your adolescence. And this study done by the US Network of Pediatric MS Centers and published in 2022 looked at a bunch of patients and then asked them their sunlight habits and then looked at the satellite data for where they lived. So now we're talking about children and when your immune system is developing. And it really showed that more UVB lowered the prevalence across the board. And I think these are really staggering. So if there's anything you take away is that this life cycle, lifestyle, and location are risk factors that you can actively mitigate for yourself and for your children. So this study looked at asked patients or children, how much time do you spend out daily on the weekend? And they broke them up into those that spent 30 minutes or less, which is, seems like a lot of time inside. Those in the middle are 30 minutes to 60 minutes. And those that are more than an hour. So if we use the control group to be those that don't seek a lot of sun, just another 30 minutes outside, cut the risk in half. I mean, if this was medicine, and we think of it as medicine that was in a pill, you would want folks, would be prescribing this. But it's free. You can go outside and get it if you live in an area with enough sun. And if it was more than an hour and it sort of plateaued after an hour, the risk was incredibly reduced, more than 80%. And we'll have a link in the show notes where people can find that article. Any questions on that?
John, so far, no questions on that. Let me check our queue. Okay, perfect. We do have a couple of questions on YouTube. If you want to get to perhaps one now, and then we can get to some later. But it is, can NB-UVB therapy used for CMT2 patients, right? And that's hello from Serbia.
So can NB-UVB be used for CMT2? TP? I don't see the question. Is it in the chat?
It's on the YouTube chat. Yeah, you won't be able to see it. Yeah, because
Okay.
we deal with we at MS Workouts, as you know, John, right? We have a lot of folks with multiple sclerosis, but a lot of folks are also joining us because they're dealing with Parkinson's, or they have had a stroke, or they're recovering from surgery, and they're So CMT2, I guess, is the question. Is this relevant for someone living with CMT2?
Well, what we do know, I don't know the disease specifically, but what the research shows that if it's an inflammatory condition, if your immune system is poorly regulated, then you will stabilize your immune system. It will respond more appropriately with narrowband UVB. So, we can search for those terms together offline to see if someone has done some research in it. But that if it's immune dysregulated, the signal is probably likely really strong. I'm not an MD, so you check with your care provider, but we'll give you as much information as we can, and we have ways to contact us at the end as well. So thank you for the question.
Perfect. Thank you, Vajislav. We appreciate it, and greetings from Texas and all over the U.S. here. All right, John, floor is yours again.
Okay, so now we've talked, that's the risk of getting MS is sunlight dependent. The next question is, well, what if you're diagnosed? Can you interact with the sun differently, and will that affect things? So I don't know if we have anyone from Sweden here, but socialized medicine, they track their MS patients. In the 15-year follow-up, they also went back to their patients and asked them, do you seek the sun? Do you go on sunny vacations? Do you hide from the sun? These sun-seeking habits, and it found their fatigue. If you sought the sun, even in the same country over 15 years, you would slow your disease progression and you would have less fatigue. And so what patients would next want is a sun surrogate. And I'm pretty sure everybody here is taking what they think is a sun surrogate, right? So can't I just take vitamin D and get all the benefits from the sun? And that was really something everybody hoped, but the data just hasn't supported it. And it first was clear in psoriasis that you needed to actually go upstream and use the light. Even though it makes vitamin D, it makes another bunch of dynamic things, nitric oxide, serotonins, uricanic acid, all these things that are happening in your skin. So unfortunately, vitamin D supplements do not reduce the inflammation. So we still need a surrogate. So let's move upstream. And that's really our fundamental message here is with these lights that already exist in dermatology, you can get 30 minutes of summer sun at your home in 1 to 3 minutes. And the data is really provocative, especially for MS. And once again, MS is the most light sensitive, meaning to us, the disease just gets worse and worse. And that's why we're matching this therapy to these patients. The lesson from dermatology, it's pretty simple. Our immune systems, the skin, they're completely intertwined, right? They face all the risks. They face all the insults that you have. And, you have an innate immune system that you're born with, but you have an adaptive immune system that you develop with over puberty. And they have enough, immune cells as there are stars in the night sky. And they need to be exercised and stimulated. And our lifestyle the evolution hasn't caught up to our lifestyle. We're not outside as much as we were. And so we're not educating and stimulating our system. And we know that it will stabilize your inflammation. And then specifically for MS, an immunologist has run the biggest trial. And an immunologist looked at this research, walked down the hall to a neurologist and said, I want to try and address this problem. I want to treat your MS patients as if they had psoriasis. And the neurologist said, sure. And she walked down the hall and went to the neurologist or to the dermatologist and said, can you treat these patients like they have psoriasis? And they said, yes. So these 3 different disciplines came together to do this trial called the FOCIS trial. So it was standard of care or narrowband UVB plus standard of care. And in psoriasis, you normally clear up about 2 months. So they gave them 2 months of therapy, 3 times a week. This was in the clinic, right? So you came in 100% compliance because people were wanting to have some control of their disease. And they reduced the relapses 30%. They had MS-specific immune signals reduced. And when I talk about MS-specific, so people on ocrelizumab, that's really wiping out all your B cells. But narrowband UVB just affected those which Dr. Hart calls the angry B cells. And then from a quality of life, the fatigue came down and the executive social functioning improved in these patients. And that's really what we're trying to see is that big need right now is for fatigue and cog fog. And we're here to try and to help patients that want to find out if it's right for them. Now, I should have CMSC on this slide. And I apologize to Marguerite and Jill, the late Jill who's passed, because of the connection from the group. But what we did is we reached out to Dr. Hart in Australia, and she sent us biobank samples. So we didn't run that trial. So we collaborated with her to use the state-of-the-art biomarker assays. As you may know, there's no one predictor of MS severity. People talk about NFL or, but this group spun out of Genentech, they've identified 18 biomarkers, this sandwich of MS activity. And Professor Hart from Australia sent us her biobank samples, and we had that assay run. And it showed that after 90 days, and once again, they're only treated for over 60 days, 3 times a week, they had a 25% reduction in what's called the MS disease activity or MSDA score. And the next question is, does 25% really, does it matter, right, if you don't know the score? Well, they've validated the score off of new gadolinium enhanced lesions, cerebral lesions, the gold standard in MS care. And it showed this group here, if you can see my cursor, narrowband UVB, this is the start. And just by chance, they were a little more severe, red being the highest severity in our group, the treatment group, and it went down to 11%. Once again, this is at 90 days, while the control group got worse. And that's a predictor of new or worsening lesions. And so 25% and severity does matter. That's our takeaway from that. And then this was really exciting because this was the presentation by Professor Ahmed Obidat from Medical College of Wisconsin at CMSC. We looked then at the fatigue because we believe the inflammation is keeping your immune system. It's just runaway. It won't rest. And if your immune system doesn't rest, your organs don't rest, and you don't rest. So if we can reduce the inflammation and the neuroinflammation, then we can speak to your fatigue. And that's what was confirmed in this analysis that we did. So we had a 25% reduction in the fatigue and a 25% correlated, statistically significant for the disease activity, and specifically the pathology of biomarkers that were inflammation and neuroinflammation. And that was presented last year at CMSC. Any questions there before I give you a chance to hear from a patient that's tried it?
Well, you know, John, just and this is right, Felipe, for everyone here who cannot see me, but I think that point that you made about the immune system, right, and needing to recover is absolutely, you know, correct. It's something that we work also with our members, right? Not exercising every day because you have one immune system, right, that does need to recover. So I think that was excellent. I have a couple of questions here before we pass it off to Kathy, who has used these lights, who actually is going to demonstrate them for you all. So it's really exciting. But let's go through a few questions. Okay, John?
Sure.
So number one, from Vajislav from Serbia. He has another question. You touched on it a little bit. NBV therapy, is it connected to vitamin D creation? So in other words, can you get vitamin D from UVB lights or therapy?
Yes, and Kathy will speak to that directly here. But one of the things that we've worked on is you'll get a dose response. And what we mean is if you have 20 or below, you should double your endogenous, your natural vitamin D score. Because naturally 90% of your vitamin D comes from your interaction from the sun, and it's in the UVB spectrum. And we think about one of the reasons, this is a little nerdy, but we think about one of the reasons that that people haven't recognized this, why everyone hoped vitamin D would be beneficial, is this same wavelength also makes nitrous oxide, releases nitric oxide. It activates urokinase. It makes serotonin. But every cell in your body has a vitamin D receptor. And so all the research hoped that you could just take a supplement and get all the benefits of the sun and then avoid the sun, so you get no risks from the sun. And that, unfortunately, the data shows we need to move back and go ahead and look at the sun. So it does make vitamin D. You'll double it if you're deficient, and but you'll make much, much more. And that's part of our research, to look for those biomarkers that are in the shadow of vitamin D. So that's a great question.
Perfect, John. And members of MS Workouts, remember, if y'all have any questions, y'all can either unmute yourselves, interrupt me or John, and ask directly, right? You will not appear on screen. I have a couple of more questions here from the YouTube channel. So let me see here from Jennifer. Does a Veralex therapy light help? Does Veralex therapy light help?
I don't, does Veralex therapy light help? I don't know the spectrum of light it puts out. I don't know that product. So okay. I don't know the answer to that. Okay. Do you, Kathy? Do you know? No.
Yeah, so
I do not.
Yeah, Jennifer, if you know the spectrum of light, post that on the comment, and perhaps we can have a further discussion about that. Couple more questions here, John, before we pass it on to Kathy. Again, from Vajislav. And Vajislav, thank you for your questions. I think they are spot on, fantastic, and thank you for joining us. So he's asking, too much sunlight, can that lead to skin damage, melanoma, concerns?
So narrowband vitamin D, do you want me to repeat the question?
Oh, yes. Let me see here.
Yeah.
Too much sunlight, can that lead to skin damage and melanoma?
So melanoma, we have that's a great question. What dermatologists have really taught us is that narrowband UVB, some patients do hundreds of uses, that does not increase the risk of melanoma. It does have a slight increase in the risk of basal cell carcinomas, known as BCCs. So it doesn't, which is the most benign cancer, or sunspots. But the melanoma risk is well studied, and it's well documented because the dermatologists are the group that prescribes it for their psoriasis patients, and they're the groups that diagnose it. So it's a really qualified opinion that doing this therapy, this narrow band, which is just sort of resonating the immune system, versus giving all of the sunlight spectrum, which together can give you a burn. And the burns are really what you want to stay from a melanoma risk, because you overexcite everything by burning them. Did that answer the question?
Yes, I think so. And I see we have a question here from our member, Karen. So Karen, go right ahead.
I have a high melanoma risk because I had melanoma about 12 years ago. And so I wondered, I guess it's on the same line as what you just answered, or what you just talked about, if the therapy is going to increase my melanoma risk.
Yeah, that's a great question to review with your dermatologist, but they will be super qualified, right? So when you're talking to your neurologist about UVB, they can scratch their heads. But when you're talking to your dermatologist about your risks, that's you're going to get a really good qualified answer. So you're in the right hands to get that question addressed.
Okay,
Karen,
thank you.
Yeah, Karen, thank you for asking. Any other members have a question? Deepa, I saw you unmuted your mic.
Yes, I did. So I have talked to both John and Kathy in the past. So thank you very much for giving this opportunity one more time to me. My question was that I do take vitamin D supplements and I go outside in the sun as well, 30 minutes on a daily basis, or try to do it that way. My vitamin D is pretty high actually. It's in its 70s. So if I start using these lights, what is the measure, or what should I watch for that's changing?
So great. It's nice to see you. I think I saw your husband stick his, he's in the room there too. So good to see you both. Just, and so, you know, the way we met Deepa and her husband was, and there's a link in the show notes and our website, is we offer a 10 minutes sort of Zoom like this to go over your individual thoughts and concerns. So that's how we met Deepa. So I can tell you from a progressive MS patient that shared their experience, about 20 years in, 50,000 IUs a week of vitamin D, still couldn't really jack his vitamin D levels up. And he came on the lights. He's actually being seen in Mount Sinai. And he came on the lights, and within 2 months, he went back in, and he had basically doubled and jumped off the charts. And the doctor was like, "What are you doing?" Right? Because he got referral from a dermatologist instead of from the neurologist. So the neurologist didn't know he was using the lights. And so the neurologist says, "What's going on? This is super high." So they've just backed off his supplements because now he's naturally making his own vitamin D and he's getting those other immune benefits. So you would expect a bump and then an opportunity to come off your supplements.
But is there anything else that'll also change? You know, you're talking about fatigue and brain fog, but how does one determine that that is really improving?
Well, that's a great segue for
Yes.
Kathy. I mean, there's online fatigue scores, which we also have on our website, so you can take it the same ones that are used in the FOSIS trial. So, and then how much vitamin D are you taking now, and which form are you taking?
About 2,000 IU pills
Daily?
daily,
And D2, D3?
D3.
Okay. So that's not a huge amount.
That's right.
We, you know, in this community, it's high for others. But the inflammatory biomarkers that were in this test is actually from a company not far from you, I believe, in Northern California. So that Octave Biosciences marker, in which Kathy can talk about her scores, but maybe it's really best for me to introduce Kathy, because I think these are real patient experience questions, which is great, because that's what I could talk about the theory and the data, but Kathy can talk, you know, patient to patient.
Let's pass it off to Kathy then, huh? Let's hear Kathy's story and experience with UVB light.
Kathy, if I can introduce you briefly.
Sure.
Diagnosed at MS in 2008, and you know, thought probably a decade of previous symptoms, as many of you may appreciate. She's the full-time MS advocate, and we were fortunate to meet her through a mutual colleague. Let me pop up your bio here just to make sure everyone can see it. You may already know her from the FUMS website and podcast, which she's founded. And then when we met her, through a mutual colleague, she was interested in getting the narrowband UVB lights. She now has a prescription for it. And Kathy, if you'll really share with everyone your experience and how it's affected you personally, I think they'd love to hear from you instead of me.
Absolutely. Well, thanks for that, John. Hi, everybody. You are my people. I also have MS, as he said. I am one of you. You are one of me. And Felipe and Elsier, first of all, thank you so much for having us. And this is exciting to talk to everybody at MS Workouts. So as John referenced, I started using one of the lights. Whoops, backwards. I'm going to show you this light. I'm going to walk over there in just a second, but I want to share a little bit first. And that is that I started using the light because I wanted to see, you know, John is great. He's smart, sciencey. He'll call himself a nerd. So I know he doesn't take any kind of issue with me calling him that as well. He'll tell you the why and the how, and I'll tell you that it does work. It absolutely has done phenomenal things for me. I was in and out of my bed due to fatigue 4 to 6 times a day. We all know about inflammation. We all were probably told when we were diagnosed to start on D3 supplements. I was also giving myself shots. I mean, it was a whole thing, and it wasn't improving. I might get my serum levels up, but they wouldn't stay up. And it wasn't improving anything. So I was very excited to get this opportunity to try this light. And honestly, I don't know if y'all find this, but I don't notice when things are going well for me immediately. I notice when things are going badly for me immediately. But I had my daughter and a work colleague both separately come to me around the same time, about a month and a half in to me using this light. And they both said, there's something different here. You have a lot more energy and your mood is better and you just seem brighter. And I went, oh my, let me think about that. Yeah, I'm not in bed as much. And I do have a lot more energy. When I really took a minute to think about it, I thought, okay, A, they're right. And B, there's only one thing that I've changed, and it's this light right here. So I knew there was something going on, and I continued on the light, and I continued to feel better. And as John referenced, there are these Octave Bio biomarker blood tests that you can have done, which I did. And my disease score, it's a MSDA, multiple sclerosis disease activity score. My original score was a 3, which is low disease activity. But after I'd been on the light 3 months and I got my next test, it was a 1, which is as low as you can go. And I mean, proof was in the pudding. So I feel like we've got, these test scores that show it. For me, all I needed was that I was feeling so much better. Also for me, probably for you too, fatigue and cog fog are besties. And that fatigue hits and I just can't think straight, vice versa. They seem to really go together, and they went together too. So it was just such a gift. So then come last spring, I'm doing phenomenally well. Everything's great. I live in Virginia Beach, Virginia. I'm a beach girl. It's coming into summer now. I don't need those lights. I'm going to be outside. The sun's going to be in the right position. I'm going to be outside. I'll get plenty of sunshine. I'll get the UVB that I need. So I'm not going to use the light. Big mistake, because hello, I have MS. It is hot in the summer. I wasn't outside. I don't know what I was thinking, honestly, but I was not outside in the summer. I was outside in the morning. I was outside in the evening. I saw sunrise and sunset, but not in the middle when I would need to be getting the, optimal UVB rays. So no big surprise. The next time I went in for all of my MRIs and blood work and whatnot, my vitamin D levels had tanked, and my Octave Bio scores were heading upward again. So, proof positive. So I'm back on the light again. Here's the really great news, though. The in-between time, I didn't feel any different. I continued to feel good, which is great news for us. But I'm glad that I, went to see my doctor and he sent me in for these tests to know, okay, it's time to get back on them. And it doesn't last forever. But, those first probably 3 months lasted a very long time for me. But I'm not going to make that mistake again. I want to pop over here and show you the light and how I use it. So I just keep it right here. I know a lot of people keep it in their bathrooms, but I keep it right here. And I just it's very easy to turn on, whoops, and you just put on your fancy goggles and turn it on, and you can wear something or not and stand in front, but you can see the size of it. And I do it on my torso. And you start at about a minute each side. So you stand there for a minute on your torso, flip around, about a minute on your back. And you build up over the course of 30 days to about 4 minutes on each side. And this is because you need to build up, your skin needs to build up. So in other words, you don't go outside the first day of summer and stay outside for an hour. You build that up, right? And you build up the tan and you get your skin used to it. And as your skin is used to that sun and building that tan, you can stay out there longer. So same thing with this. But I mean, gosh, this is just about 8 minutes a day at its max. Inside here where it's nice and cool, or as now, nice and warm, I'm not having to check any UVB index. It doesn't matter. And it continues to provide me this energy and this clarity that I absolutely was missing for many, many years, though I tried everything to, turmeric. I mean, I knew that there was a correlation between inflammation and this fatigue, but I couldn't figure out what I could do that was going to really impact it and make a difference in my quality of life and day-to-day activities until this light. And this made such a difference to me. I will still lay down a time or two during the day. That has nothing to do with my energy levels. It has everything to do with my spasticity. But my energy levels are great. My mood is great. My clarity, for the most part, is great. And I'm just thrilled to find it, especially something non-pharmaceutical, because I know you all know this language I'm talking, which is you have any issues, you talk to your doctor and they go, let me write you a script. Or here, let me write you 3 scripts. And now we have to balance that with all the other meds that we're on. And surely to hell, we're going to have some kind of horrible side effects. And you have to manage that. And it may or may not work, but you need to try it for at least 3 months. I know you know what I'm talking about here. I am preaching to the choir. But this answered, it did what I needed it to do. It was easy. It was convenient. And it was non-pharmaceutical. So check, check, check for me. Have been very, very happy with the light. So with that, I'm going to stop and see if there are any questions.
Well, and Kathy, I thought that was an awesome presentation there, experience share. I was, really interested in our conversation before the presentation, how like I thought that, oh, well, we live in Texas and there's lots of sunlight. So, right, like we're covered. And like you're saying, like, no, like it's extremely hot. And if you're stepping outside, you could have an exacerbation of symptoms, right? There's all these things that like, yeah, I mean, in the summertime, I'm thinking I really do just stay home all day.
Yeah, right.
Also, did you have a question, comment?
I have a question. How much skin needs to be exposed? How much skin? Like you mentioned, so how much skin?
Yeah, I expose from my neck down to my torso, to my chest and my back.
Okay.
And the reason, just to follow up with that, Kathy, thank you for that great discussion. With this concept that keeps going up, your MS workouts, use it or lose it. Your body is best and used to converting sunlight into things to reduce inflammation only where it sees sun, right? You can train it to start seeing it on your legs slowly, but generally your hands, your forearms, your neck, and your face are known to be like 8 times more per square inch productive at absorbing UVB for benefit. And they measure that by vitamin D. I don't want to nerd out too much, but the studies where they're actually looking at what areas light up, and so the torso is over the American Academy of Dermatology says get more than 27% of your body, and that's the torso. And so these small lights get it done. So this one series.
All right, John. So we got this question about 8 times on our YouTube channels. Okay, so we're gonna knock out lots of birds with one stone, and it's a very important question. And it is, how and where do I get these lights? Right, this is very exciting. How can I get them? So, John, please jump into that. And please note too, John, we have about only 10 minutes left here. Okay, keep that in mind.
All right, I'll just give Kathy's address.
Yeah, there you go.
Party.
Thank you for that, Kathy. So that's really the topic we want to talk about. So you can go to our website. We're a distributor for Davlin. These lights are presently FDA cleared for dermatology only. And I'm going to briefly talk about why that's important. If you can pay out of pocket, that's great. That's not the majority of patients, especially in MS with a high rate of disability. But if you look at dermatological conditions, most of the Medicare and most major insurers cover up to 100% of the cost of these. And that's important because if you have MS, you have a really high chance, a much higher chance of having psoriasis or eczema. Pruritus is an itching of the skin if you hopefully don't know it because you haven't had it, but it's itching. It's often when you get chronic kidney disease as well. So if you have those diseases, those are common overlaps. So dermatology could get you covered. But if we wanted, so be an advocate, do your own homework. You should be well experienced at that in fighting the U.S. healthcare system. Our first indication we'll touch on briefly is likely going to be for pediatric MS. We've had multiple conversations with the FDA and met with them, and they talk about really how to get patients, the need for stakeholder alignment. And this conversation with the MS workout group is key. You need a payer, provider, and a patient to help get that data through. And we've already submitted the clinical data that we shared with you to the FDA. So if you want to purchase one now, we're a distributor in the US. If you're overseas, email us. We'll introduce you to Davlin's distributor in your country. If you're in every country except Canada, I know we've had some calls from Canada, everywhere else, you're going to need a prescription. So you can discuss with us, pick a light. The small light here is $1,825, fully loaded with the software. It's $2,075. We can talk about the cost for the 6-foot version, really sort of time, energy, footprint, available space conversation. Then with that prescription, you place an order, then how you get that coverage, that we can help you navigate. And we also have financing options. So go to the link off our webpage and in the show notes, schedule a 10-minute call with us, and we'll try and move that conversation forward so you can start getting treated as soon as possible.
And just to be clear too, it's cytokind.net, correct, John, is the website? That is
cytokind.net, yes.
Included in the description box below this video. Okay, so if you're watching on YouTube, you can find that below. And if you're watching this as a member on the replay, download the slides and you'll find that information there. Oh, well, look at that. Perfect. Contact. Boom. All right. John, anything else here? We don't have any other questions from the queue. One individual did ask, and I think, it's worth mentioning. I grew up and worked sun up to sun down. What am I missing? Right? Clear frustration in that voice. Like, I got the sun. I was working. I was outside. Right. And assumingly here, I was also diagnosed with MS. Any thoughts on that, John, before we conclude today's conversation?
The first question would be, where were you for that patient? Where were they living? Where did they grow up is the more important than where they live now. That's so they talk about, you pull that sunlight history.
Okay. I will ask them, but I don't think they'll be able to respond in time.
Oh, okay.
Yeah.
We culturally, and I'll share, we talked about this, right? This concept that we can hide from the sun and hide from our environment is good for our children. The data just really hasn't worked out. And MS is, unfortunately a big predictor of that. And so we think, we can just help inform patients, people that you're concerned about as well, and the children, you can really look at doing, just get educated on this, make your own decisions. But that old school, which I grew up on, which is go outside and come back at dinner, I grew up on a farm. I don't think that was a mistake. And so this inflammatory condition, MS is there, ALS, Alzheimer's, COVID was really, really strongly UV. The mortality of COVID was really strongly tied to UVB as well. Hopefully I've answered your questions. I look forward to any outreach you have, and Deepa, I know, I'll be in California next week. Hopefully we'll get you all set up soon.
And are there any members here of MS Workouts who have any questions before we conclude the call?
I do.
Claudio, what's up?
Yes, my question is, does the exposure to sunlight or to this light have the same benefit for Parkinson's patients as it does for MS?
That's what is the relationship between narrowband UVB and Parkinson's is the question. And so when we looked at, we actually were really very closely to focusing on Alzheimer's before we focused on MS. We're a small group, but we're mostly based on the research. But Parkinson's is certainly a population to look at. And I'll tell you one really overlapping aspect. Octave Biosciences, which has developed this 18 proteomic advanced screening for MS. They are now, they have a huge funding now from the Michael J. Fox Fund, and they are developing that same profile and looking at it for Parkinson's. So the inflammatory aspect of Parkinson's, we think we will absolutely improve. The question is, will it be enough that you will feel better? And we need patients to use the lights and report back to us and sort of motivate us or support for a study. Kathy knows this is an interesting model to try and get to patients, because this is affordable at-home care, and investors generally like expensive, hard to get treatments. So, these N=1 experiences are really informative of us for patients to reach out. It's safe. It's been used for decades. Can it help you? Talk to your care provider and let us know. But that biomarkers that are in Parkinson's, Octave certainly thinks are important for MS as well.
Thank you.
Claudio, thank you for asking that question. You're not the only one, right, with that concern, right, that question as well. So I really appreciate that. John, to be clear, the prescription needs to come from the dermatologist, not the neurologist, correct?
It can come from any care provider, a nurse practitioner. We know a bunch of nurse practitioners and doctors on the East Coast for patients whose neurologists are just confused. They say, well, maybe you should talk to a dermatologist to get it. So we have done that. We have, if you reach out to us, telehealth is by state. So you need to let us know whether we can put you in touch with one of them. So anyone by state that can write a prescription can get you covered, right? So it can be done by a telehealth visit as well. The one question on the Parkinson's, Alzheimer's, and MS, one of the things they also share is the disease that culturally people go out less. So there's this negative feedback, right? That you feel you're going to have a relapse when you're away, or you're going to have a challenge when you're away. And we think we help interrupt that by giving you the sunlight benefit whenever you want it at home. And so, that aspect of getting out, particular to these inflammatory conditions, is something that we really want to hear from you and want to see if we can help.
Perfect, John. Well, we got lots of really great feedback here from the channel. I'm just going to read back a couple of them for you guys. We have Karen, who said this is awesome presentation. We have Destiny. Thank you, everyone, for this knowledge and help. We had Vajislav say have an amazing 2025, and I really appreciate this information. So thank you, John and Kathy, for hosting, for having come to this, for having hosted this presentation. I thought it was awesome. I'm going to go ahead and leave it here to y'all to see if you guys would like to kind of say anything before we talk about a little MS Workouts news and conclude the meeting.
I just want to thank you all. I appreciate your attention, your questions. Feel free to reach out to us if you have any others. And thanks, MS Workouts. It was wonderful.
Thank you, Kathy. Thank you, Alcir and Felipe. Really spending a little bit of time the past couple of weeks ahead of this has really made us comfortable that this message of a conservative treatment is really consistent. And so we're really pleased to meet your community. And we wish everyone a happy 2025 and hope to hear from you soon.
Happy New Year.
Bye, John. Bye, Kathy. Thank y'all.
Bye now.
Thank you.
Bye, everybody. Thank you.
All right, everybody. So this is Felipe again here, the MS Workouts Member Support Specialist. Just going to conclude today's meeting by telling you all thank you so much for joining us today. To the members of MS Workouts, I hope that you have an awesome live class tomorrow, right? We're doing the live strength training class, but of course it's also on demand, right? You can do the on-demand version if the live time doesn't work for you, but I hope you guys really get in a great workout, okay? We have more live events for the members of the Steady Pace Club, right? You guys can join, like I said, the live workout class tomorrow. We have the Friday community chat with Jacqueline to kind of wrap up the week together and connect with each other. It's always a really, really great experience. And then, of course, if you're not a member of the MS Workouts Club, but you want to be, you can go to msworkouts.com/2025 and you can enroll in the annual plan paid monthly. So you don't have to absorb that $468 all at once. You can just pay monthly $39, okay? So that offer is only available until Thursday, January 16th. That is right around the corner. We want to help y'all in 2025. That's why we're post on this YouTube channel, right, to get you guys exercising, but really joining the club is going to take those results to another level. We'll be able to have many more tools to be able to help you reduce your symptoms, right, without pharmaceutical intervention, which I think is kind of really, really great. So thank you all again. Alcir, would you like to kind of say anything before we wrap up?
Yeah, so thanks everybody. Basically, no, just to remind you guys. Sorry, my audio is not working. Is it working, Felipe?
Yes.
Okay, sorry guys. No, so like I mentioned, so if you guys have any other ideas about presentations, please let us know. We have Dr. Kat's schedule for next month, but yeah, this came from one of our members. We reached out to the folks for Cytokind, and then you got it. Right? You got your really, really, comprehensive presentation. So please let us know, and we are here for you guys. Thank you.
I had a question, Felipe.
Yeah, what's up, Deepa?
I was wondering whether this will be available for replay on MS Workout.
Oh, yes. The same day, Deepa, you'll get the replay, okay? They'll be on the weekly Q&A replay. Probably give us about 6-7 hours, and you'll see it on
No,
the site.
no worries. Okay, very good.
Okay.
Thank you. Thank
All
you.
right. Thanks so much for joining, y'all. Take care. We'll see y'all next week. Bye, everyone.
Thanks, everybody.
Thank you.
Okay. I think we're safe.